My name is Dr. Samir Puri, and I'm the founder of CerecDoctors.com. I'd like to welcome you to this video where we discuss the benefits of using a microscope to aid in the treatment of our patients. As a long-term Cerec user, one of the most valuable tools that is in our arsenal to create well-fitting restorations is the use of magnification. Magnification allows the Cerec clinician to see all things that the bare eye has a difficulty in seeing without assistance. Considering that the design of a Cerec restoration is typically completed on a blown-up model on a large monitor, it is important that the clinician provides the Cerec system the proper preparation for the machine to fabricate restorations with the best possible marginal integrity. To get the best marginal integrity with the Cerec, the key is smooth and polished margins. Because of the way that the milling unit mills the margins of the restoration, the requirements from the system is that the margins must be as smooth as possible. The analogy that I give in our hands-on Cerec workshops in Scottsdale is that the margins must be glass smooth. There are numerous techniques and instruments that can be used to fabricate glass smooth margins, from high-speed handpieces to hand instruments. However, the common bond between all of these finishing techniques is to be able to see what you are doing with proper magnification so that the clinician can view the margins with ease. This is where a microscope becomes invaluable. Another reason that I've personally used a microscope for years is that it simplifies my ability to document cases for educational purposes. This is critical for someone who is presenting cases regularly. Having the case documented through a scope in either video or still format is an invaluable tool for both doctor and patient education, as well as to contain any potential medical legal situations that invariably may arise in the clinical setting. With the importance of magnification and documentation discussed, one more benefit for using a microscope is ergonomics. Dentists are notorious for poor posture, and there's little doubt that a microscope can be invaluable in helping to correct this posture. Having said all of this, one of the more advanced microscopes that is currently available for use by practitioners is a Seiler Evolution Zoom. There are numerous features in this scope that many clinicians have found beneficial and that make the scope easy to use. While Seiler makes several different models, one of the features that is unique to the Evolution Zoom scope is a motorized unit with many of the common controls built into that motorized unit. With a fully motorized focus and zoom that is directly on the handle, easy adjustments to the viewing fields can be made while the doctor is working on the patient. These adjustments through the motorized unit include adjusting the magnification, light intensity, as well as the focus. The fine focus system is built directly into the handle, which allows precise adjustments of the focus of the operative field. Unlike other scopes, the operator only needs to press the motorized focus button to change the focus. Manual movement of the actual scope, which is inefficient and cumbersome and slows down the procedure, is not necessary with this automated technique to get the clearest picture. If the clinician's hands are occupied and involved in the procedure, and moving the hands out of the operative field is not desired or is inconvenient as it will disrupt the flow of the procedure, a foot pedal is available that allows the operator to adjust the focus, magnification, as well as light intensity, all while keeping the hands occupied in the procedure. These are the same features that are controlled by the motorized unit mentioned previously. However, these can be controlled without the use of the clinician's hands. The light on the Evolution Zoom scope is powerful and efficient. Because it is an LED light, it has over 100,000 lumens and a projected lifespan of over 50,000 hours. As mentioned previously, this LED light can be controlled by both the motorized hand-mounted control or by the aforementioned foot pedal. The Evolution Zoom lenses are designed to have no spherical aberrations, which in layman terms means that the colors are rendered through the optics true and with excellent resolution. Because the scope is available on wheels, in our center, we are able to easily move the scope from anywhere in our complex. This becomes necessary as we use the scope for demonstrations during workshops, and these workshops are held on the second floor, and this scope is also used for patient care, and our clinic is on the ground floor. The scope is used in many of the different workshops to demonstrate procedures, as well as during the course of normal and routine patient care. While the Evolution Zoom is a great motorized and fully automatic high-end system, some offices may opt for a more basic version of the scope from Seiler. To serve the needs of these clinicians, Seiler also makes their Air series. The new design of the Air series is more sleek and modern, and this is currently the lightest microscope on the market, which makes moving the scope from operatory to operatory a breeze. While it doesn't have many of the automatic features of this Evolution Zoom, the scope has a new longer pantographic arm, and this is coupled with a new angle arm which allows for one of the smoothest movements of the microscope head on the market. The Air series scope also uses an LED light that is 125,000 lumens in brightness. This currently is the brightest LED light on the market for any microscope and easily lights up even the most cramped of oral cavities for easy viewing of the operative field. In discussing the importance of documentation earlier, there's a USB port directly on the optical pod so that you can easily attach a still or video camera or have that USB port available to continuously charge any type of camera that you may want to use for your documentation. One of my personal favorite features is the ability to attach a GoPro camera directly to the Evolution Zoom scope. With this attachment, you can document live either 4K video or 1080p video, as well as take still 12 megapixels images as needed. A GoPro is a nice documentation device due to its relatively low cost and ease of operation. Simply place a micro SD card into the port and record your video. Then remove the card, place it into your computer, and edit the videos as needed. The Evolution Zoom actually has two optical ports that allow you to attach a GoPro video camera on one side and an SLR still camera or other recording device on the other side. This gives the clinician the flexibility to record separate still pictures as well as live streaming video all at the same time. Having practiced dentistry for close to 20 years now, I cannot stress how important it is to have a clear, clean visual field to work in where you can clearly see your operative environment. A microscope is an excellent adjunctive tool not only for doing more complex and obvious procedures like endodontics. The benefits here are clearly known, but it's also a fantastic tool for more routine procedures such as crown and bridge and simple restorative work. The ability to visualize your operative field, maintain your ergonomics, and give you the ability to document your cases with either still images or live video make the microscope an incredible tool in the clinician's tool belt. I personally found that the learning curve of this scope to be minimal and the benefits tremendous. If you have not used a microscope in the past, I encourage you to try one to see how it can benefit your practice. The Evolution Zoom and the Air series are certainly excellent examples of well-made microscopes. For any further questions, do not hesitate to contact either your Seiler rep or post your questions on the CerecDoctors.com discussion forum. Thank you for watching this video, and I look forward to seeing you in Scottsdale in the near future, where you can try out one of these scopes in person.